Good morning and happy Easter, everybody. We have wonderful news that we only have one new case in Queensland, which is overseas acquired and in hotel quarantine. So we've had no new locally acquired community cases, which is wonderful because we've had 14,011 tests on Saturday, Easter Saturday. So thank you to all those people who are still coming out and getting tested. The clinics are still open today and tomorrow, so if you are feeling unwell, please go get your test and stay home and wait for your results. We are now at 72 active cases. We've had a number of discharges overnight, and this brings us to a total of 1,489 cases that we have had in Queensland since the start of the transmission. So this is really good news with all those close contacts and all of the testing we've done, that we're seeing negative results coming back. And this is all part of our plan with the 3-day lockdown to ensure that we can get enough people out there tested, identify the close contacts and get them into quarantine to keep everyone safe. And this meant that we can open up our economy, we can enjoy Easter, and it is wonderful to see that our tourism operators are recording record numbers, that they are seeing lots of people taking up the opportunity to book accommodation and enjoy the Easter holidays and the school holidays coming up. Of course, we know COVID is not over, and we have seen still some concerning statistics internationally. We are still seeing deaths in the UK and in Italy. We know that positive cases are still going on every day around the globe, and sadly people's lives are still being lost. I'm happy to hand over to Dr. Bennett now and just give her, she'll give you a report on the overseas acquired case. Thank you.
Thank you, Minister. Good morning, everybody. As the Minister said, we've only had one case today notified in Queensland, and that case is in hotel quarantine and had overseas exposure in Pakistan. So that's fantastic news. That, along with the one case yesterday, the one locally acquired case that was already in quarantine when they were diagnosed, which means they weren't infectious in community, really highlights, I think, that we're making great progress in this most recent outbreak. And what I'd like to do, probably Easter Sunday is a good time, just to thank everybody. It is the Easter weekend, and there are a lot of people who find themselves in quarantine at the moment that didn't expect it, and that's obviously very difficult, and we'd just like to say thank you to those people, because it's all contributing to this outbreak response. Thank you to all the public health units and their contact tracers who have really worked tirelessly over the past week to find all those people and contact trace them as well, and continuing to work over the weekend, a whole team, including my team as well. The authorised officers, QPS, a whole range of people have worked really hard to get this outbreak under control. And as the Minister said, all the community who have turned up for testing as well. And so I think we can be confident that most of the contacts and people at risk that we've identified have been tested. But anybody in the community who has symptoms, please turn up and get a test. Tests are easily accessible now. It doesn't take very long, and the turnaround time for results is very quick. And that way, together we can all manage to find any cases that might be in community and manage them. And the other thing we're continuing to do is wastewater testing. So just be alert locally to any alerts in your area for wastewater testing. The public health units will let people in the community know if there are any concerns. We don't have any I'm aware of at the moment, but it's just another method to keep yourself informed about any risk in your area. So thank you.
So what we've identified, what Dr. Young has previously stated, is it appears at this stage that it's something to do with the environment in that ward. That's why we have moved people out of that ward, and we've done a deep clean because we've seen 2 different individuals coming in as positive cases at different times infecting 2 health workers each. So we know it's not related to one individual. We know it's not related to one individual in relation to how they have donned their PPE or worn their PPE or any breaches by any one individual. Because it's happened on 2 occasions with 4 health workers over different days, there is a view that this is about the environment and that's why the deep clean has occurred. We're looking at the moment other options of having a single area in one hospital where we can bring COVID patients instead of spreading them over different hospitals in Brisbane. We believe that will reduce the risk and help with our resources as far as our health workers and making sure that it's only health workers who are vaccinated also working with their staff. So those are the steps that we're taking currently.
Where would that likely be?
Where?
Yeah.
Oh, well, we're still looking at options, but we're looking at RBWH at the moment.
And how long do you expect the PA to be locked down?
So I'll see if Dr Bennett has any answer on that, but obviously we have the general lockdown across the state at the moment when it comes to hospitals, so you're only to visit hospitals if it's an end-of-life situation and it's been approved. Otherwise we're asking people not to visit hospitals. But I'll just see if Dr Bennett can update on the PA.
So I think the question was how long will the PA be expected to be in lockdown? So the main work at the moment around the PA is really to do their contact tracing both around their staff and their visitors and ensure anyone that should be tested is tested, anyone that should be quarantined is quarantined. And then they'll need to have a look at their workforce, obviously. There may well be a large proportion of the workforce who are unable to work, and so they'll need to work through that. So I don't have a date either, but the priority being at the moment just to finalise all that contact tracing and make sure, as I said, anyone who should be tested is tested.
Contact tracing is involving their families and other close contacts from there as well.
It will depend, so clearly what we do, if there's a high risk contact, a close contact, and they live with other healthcare workers, then yeah, we treat that family member cautiously and conservatively as well, sometimes asking them to stay home with their family member, but not in every case, so that's a sort of case-by-case situation.
The investigation to look like that's not seeing that if there was any sort of breach of PPE or any sort of malpractice, it was in the environment that COVID potentially.
So that's what the investigation is going to look at. It's going to look at all those factors. There certainly was, in the most recent case, very unusual circumstances and not related to a breach of PPE per se. So that's exactly what the investigation will look at. What are the other factors? I think I've said here before there are a range of factors for transmission of the virus, and PPE is one such thing. Airflow, ventilation. We've seen those issues in hotel quarantine as well. It is a virus that, given any opportunity, it will find a way to spread.
How many people from the PA at the moment are in quarantine as a result of those clusters?
I don't have that answer at the moment, but there's many hundreds, I think, who are being contact traced. So we'll try and get those figures out to you soon. Yeah.
These 2 cases where they believe the spread has happened in the same room, are you able to explain, were they on ventilators or anything like that, or is there any potential risk there?
Were the cases on ventilators? No, they were just being cared for in a standard ward, so there was no ventilation, no event that would have, what we say, contributed to aerosolised spread, and so that's the concern. And the reason for the investigation is to, exactly what about the environment and other factors might have contributed to the spread.
Can you maybe just explain on record, so when someone gets COVID, what's the process? They obviously get taken to hospital, but then can you just explain, how are they put in their own rooms, all these kinds of things?
So Dr Young has a policy of any COVID case being cared for in hospital. Now, as we know, not all COVID cases are unwell. Some of them aren't unwell at all, which doesn't mean they're not infectious. So those cases who are very unwell and require intensive care will be admitted to intensive care. And so cases are cared for according to how severe otherwise their disease is. And other than that, they're cared for in single rooms, in wards, with appropriate PPE worn by healthcare workers and themselves when necessary.
What do you make of this idea of isolating all the COVID cases to one hospital instead of spreading them out?
I think it's something Dr Young wants to look at for obvious reasons. I think there's no one there's no one perfect solution to caring for cases, in the same way there's no one perfect solution for quarantine. It is about finding that best solution, and in this instance, it's felt that caring for cases in one place may well be the best way to minimise that risk of transmission, and have a dedicated workforce where you're very clear on how those cases are being managed.
And so the whole would, like the whole, a whole section of the Royal would potentially be locked off just for that care?
Look, Dr. Young, when she comes back, will be able to tell you exactly what the details are of where that might be and what it might look like. But suffice to say, as the Minister has said, that's the option that's being explored at the moment.
What do you expect the capacity would be, or what do you think the capacity should be in a single centralised COVID treatment?
That's a very good question, because I think if you'd asked us weeks ago or months ago, we wouldn't have said that we would have had so many active cases in the state at one time. Clearly, the situation in Papua New Guinea has contributed to that, and we've seen many more cases reported per day from overseas travel needing to be cared for in hospital. So there is a density case, though, that we'll be able to manage, and I think rather than pick a number, I think it's more about managing what our capacity is alongside with the Commonwealth in managing international arrivals, as well as doing our part to ensure there's as little as possible community transmission to contribute to that.
But I guess to get the benefit of a centralised place, you want only cases to be there, therefore you need quite a substantial capacity to enable it to cope as well. I think you've got 70-something at the moment, so you need at least that plus some.
Yeah, so that's a large number of cases that we're caring for at the moment, and I'm sure that's probably the figure that will be being looked at. As cases are detected around the state, there may be cases who need to be cared for in Cairns when they're diagnosed up there and may stay there, but it's really about the principle of caring for cases in one spot as much as we can.
What's a normal size hospital ward? Would that need to be multiple wards that would then be turned into a centralised hub?
Sorry, I can't quite hear the question.
A normal size hospital ward is how many beds? I'm just trying to get a sense of whether you would need multiple regular wards to put together to make that centralised.
Can I just address this?
Yeah.
This is simply an option being explored at the moment. So we are looking at what is the best model going forward to reduce the risk of any spread of transmission of COVID with our positive patients in our hospital system. At the moment, they're spread across a number of hospitals. We're not suggesting it'll be one single hospital across the whole state, because we'd still be using others outside the Brisbane area as well. But this is simply an option. So all of the questions you're asking are the questions we're asking at the moment. We're just looking at what would this require, what services would need to be around those wards, how many beds would need to be set aside. So it is simply under exploration at the moment, and there has been no decisions made.
Are you now 100% confident that the lockdowns work? Have you got to that stage?
Oh, look, I don't think we can ever be 100%. What I do know is that it has given us the opportunity to contact trace, to identify, to test and contain. And that's what the lockdown's all about. It's actually tracing, testing and containing, and we've been able to do that. So we've been able to get these people into quarantine, and we saw yesterday a positive case of someone who was negative when they went into quarantine and became positive during quarantine, which means they haven't been out in the community. So that's what the lockdown has allowed, and it's meant that we could open up for Easter, which is fantastic, because we were able to trace I think the figure's over 3,000 people, and ask them to go into quarantine. And I thank those people. I know it's a difficult time, it's school holidays, it's Easter period. We're asking people to quarantine, not just from the community, but from their loved ones in their own homes, so they're not spreading it. So we really do thank them. As Dr. Bennett has said, also all of our health workers and our emergency service workers and frontline staff that are working over this weekend.
You mentioned the RBWH in particular. Can you explain why that hospital in particular is being considered as part of this plan?
As I say, we're exploring options at the moment. That is one of our options that we're exploring. It is a central hospital that has managed the COVID virus very well in their environment, but we need to look at all options. So it is just one of the venues we're looking at.
Minister, in terms of the vaccine rollout, are you concerned about the number of aged care, people in nursing homes? The federal government's done about 22,600 doses, which is only about 25% when you look at workers. Are you concerned about that, and is there any idea about Queensland Health stepping in to help them fasten it up?
Look, it's the Commonwealth's responsibility to do the aged care vaccinations, and so those are questions best put to the Commonwealth. Of course, we would like to see the vaccination rolled out as quickly as possible, but it does come down to supply across the whole country, and we know that is an issue at the moment. So until we start seeing the AstraZeneca being made and provided, I think they're talking of 1 million a week, hopefully, from here in Australia. Until we start seeing that local supply rolling out, it's always going to be an issue as far as the timing of how quickly we can put it out. As far as Queensland stepping in to do the role of the Commonwealth when it comes to aged care and their workforce, we're concentrating on our area of responsibility. This is what we've agreed to with the Commonwealth, that we will do all of the health workers, that will do frontline emergency service workers, we'll do the correctional services, and we'll also do meat processing. And you heard Dr. Young yesterday talking about doing the families of our frontline health workers who are working with COVID patients and in hotel quarantine as well. So we're concentrating on getting that group done, and I know the Commonwealth's responsibility is concentrating on aged care, the residents, the workforce, and of course that broader community in 1B.
Sorry to have been answered before. Will there be a formal report released in relation to that investigation at Ward 5D, and what date is that due to be released?
Look, we don't have a fixed date. We're going through the process. Our priority over the last week has been to do the contact tracing, testing and quarantining. That has to be our priority to keep Queenslanders safe. We do have people looking at, and Dr. Michael Cleary is looking at all of that, but I don't have a fixed date. Of course, we will do what we have done every single day since COVID started, and that is keep the community informed. So when we have any definitive findings, we'll certainly advise the public.
Do you think the restrictions on aged care and hospitals will be lifted at the same time as the mask mandate is lifted to 2 weeks from?
Oh, look, I couldn't say that at the moment. That we'll take the advice of Dr. Young and Dr. Bennett when that time comes. But we know that it's important, and Dr. Young said this the other day, that it's 14 days at this stage. She generally likes 2 cycles, being the 28 days, but let's go with the 14 days and we'll be reviewing it. But we need to make sure that there's no more transmission in the community before those restrictions can be lifted. But we'll take the advice, of course, of Dr. Young as to when she thinks that needs to occur.
And do you see a need for Western Australia to keep the ban in place for Queensland residents?
Look, that's up to Western Australia. It is up to each jurisdiction to decide what they do with their restrictions, just as Queensland concentrates on Queenslanders and keeping our community safe. It's up to Western Australia what they do with their restrictions.
You mentioned that it's Royal as a central hospital that had managed COVID very well. Does that mean that the PA is out of the race of being one of those central hospitals to have it?
Not at all. As I say, we're just looking at options, and we're looking at space and what capacity our hospitals had, in particular our big hospitals in Brisbane. Thanks, everyone.
Happy Easter, everyone.